So, Dr. Patel, a lot of patients wonder what might have caused my myeloma, and there are some environmental factors that are known to have an association with myeloma, like Agent Orange exposure. And now we're seeing an increased incidence of myeloma and other blood cancers in the 9/11 first responders. For patients who might have concerns about this, do you have any suggestions or thoughts on that?
Yeah, I've actually had quite a few patients have, come up to me that were in, previous wars, were are veterans. And, the first thing I talk about is the 9/11, first responders. So people ask me if they were born with myeloma. That's the number one question. And I say, likely not. Most people do not have genes that they were given by their parents that causes myeloma. All of us have different susceptibility to cancer based on how our immune system repairs itself, how our plasma cells repair themselves, the microenvironment, but it's also our exposures. And we know that there's certain exposures like Agent Orange, as well as those first responders that went in, where in terms of epidemiology, in terms of the number of patients that ended up with myeloma at a younger age, a much younger age, they're in their 50s, for the most part. That tells us that this was not something that those folks were going to get. This really was based on that exposure. And that's the hard part of saying that something causes something, right? I think we know with 9/11 the numbers were so high that this was this is something wrong. That whatever they were exposed to during that process led to their plasma cells becoming myeloma at a much younger age. And it seemed that a lot of them had more aggressive disease than the indolent, slow growing myeloma we see that a lot of patients get. The other big question I get, is how can we say that something caused this? And then again, it comes back to how many people were exposed and then how many people actually got that disease. And that's why it becomes so hard. But I know a lot of my patients, think about Roundup or, different petrochemicals and things like that they've been exposed to. And I know that, the government and folks are looking into it, because a lot of my patients are, getting letters from us and things like that, just to say, listen, I was exposed to this. Could this have caused, my myeloma? And again, the majority of patients are not exposed to things at that level that really tell us that that's what caused their myeloma. But I do think that if you're exposed to something like Agent Orange or, major petrochemical spill or something, that is worthwhile noting, at least. Even though I most likely won't be able to tell you it definitely caused the myeloma. We do know that there are environmental exposures that are more likely to lead to cancer. We have these hotspots in the U.S. where, especially those petrochemical companies are, where there's a much higher level of just cancer diagnosis, not just myeloma, but cancer in general, compared to other areas where we don't have those, industrial companies existing.
Do you happen to have any tips for patients who maybe were a part of the 9/11 event, or even veterans or first responders of any type? Any tips for them in general?
Yeah, I think that the activation tip here is that if you notice that anything is off, you're not feeling well, or the labs, something is wrong with your labs, make sure to mention that to your physician so they can first diagnose the correct thing if something's going on. And two, if you actually have a diagnosis of cancer, I think talking to your teams, that there are probably resources out there to help with a couple of things. I think one, even financial resources. When stuff like this happens, usually there are some financial resources that pop up. And two, the mental aspect of this, right? That you got this while you're doing something you were supposed to be doing, and helping others, and really, finding patient groups, which are out there as well, so that you get the resources for, just the ability to talk to someone about what happened, and being able to, go through that process as well.
Dr. Patel, are there any notable trends or patterns in the presentation and progression of myeloma and other blood cancers in veterans and first responders that differ from civilians?
Yeah, that's a great question. And, I honestly don't know if there's been anything published that shows a difference. I tend to see my veterans are a little bit younger. In general, average age for myeloma is 70 for Caucasian patients, it's 65 for Hispanic patients, and 66 for African American patients, right? So a lot of my veteran patients have been in their 50s, just a little bit younger than what I've seen with most other patients. And then in terms of patterns, not necessarily, we think, oh, is it more aggressive? Is it not? I do have patients with aggressive disease, but I have patients that come in with MGUS or smoldering disease that eventually turns into myeloma, but isn't necessarily high risk or aggressive. But again, I don't know any data that's out there that's published. I think that would be worthwhile. But I will say my patients tend to be on the younger age.